Time to visit with Dr. K, Dr. Kevin Kavanagh from Health Watch USA. He started that national and becoming international organization. Good morning, Dr. K.
Good morning, Jack.
How you doing this morning?
Doing very well. Very well. A little cold, but other than that, doing well.
Got to ask you about this. This is one that is for the books. They're talking about, I'm looking for the story here. Anyway, they're talking about a combination of Delta and Omicron. Have you heard that as a thing, or is that just stuff online?
Well, I have, and you can also get flu at the same time. How exactly those cases are going to work out, I don't know yet. I don't think anybody really does, but it doesn't sound like a good thing. One of the things you need to remember that we're really not sure if you get Omicron, will you be immune to Delta, or if you get Delta, will you be immune to Omicron? Hopefully there's some crossover that you'll at least have some protection and have less severe of disease. But it is possible to get them both at the same time.
Let's see here. Wait a minute. I think here it is. Researcher in Cyprus discovered a strain of the coronavirus that combines Delta and Omicron variants, people calling it Deltacron, but they say, as you say, too early to say if there's going to be more cases, what impacts they could have. Just one more thing, though, I guess, for us to worry about, right?
Well, yes, but remember, most of the variants, even the ones that look very horrible, they don't spread much and they tend to die out. We saw that with Lambda, we saw that with Kappa. There's a IHU, I believe, variant out of France. I think that hasn't spread much. So in order to really have an impact, it also has to spread. And most of the time, that hasn't been happening.
Another story I read this morning that I highlighted to ask you about, according to a report from the Centers for Disease Control and Prevention, COVID-19 may raise the risk of type 1 and 2 diabetes in children. Can you tell us anything about that story?
Well, Jack, I think this is a case that you need to realize this virus isn't the flu. It affects every organ of the body. So I think we're going to find that being positive for COVID-19 is going to correlate or make a lot of different diseases worse. One of the things that I'm sure is going to come up this Friday is that, well, most of the patients filling the hospitals really don't have COVID, even though they're COVID positive. And the response that one of the doctors had, yes, but they're still filling the hospitals. And as you know, as early as, I think it was August, September of 2020, we had been advocating that this is as much a cardiovascular, a GI virus, as it is a flu virus. It affects many different types and organs of the body. And so you just have to realize that if you come in with a heart attack, you come in with a stroke, and you're positive for COVID-19, you may not have had that stroke or heart attack in the first place. During one of our meetings, we had a case report of a child who, well, I shouldn't say child, he was 33 years old, but came into the hospital and had severe heart problems, all of which was caused by COVID, but he had no respiratory symptoms. And in that case, this was primarily a heart virus where it was attacking the heart and vasculature. So I think we're going to see this. We're going to see a lot of correlations with other diseases. The big question is, in my mind, if all of these cases are coming in with different manifestations and presentations and they're positive for COVID, the big question is that rate of positivity greater than the community? And if it is, then probably COVID had a contributing cause to this problem. And so the hospitals are filling. We are in crisis mode in many areas of the nation, and we need to take this surge really seriously. Hopefully we can blunt it, and hopefully it will not last long. I'm hoping for weeks that it's going to go down as fast as it went up.
And you have some stats here about hospitalizations with COVID. Can you share some of those?
Well, yes, 138,000 hospitalizations with COVID-19. But again, in that group are going to be people that are positive, that maybe came in with a, broken arm. Who knows? But nevertheless, they're filling the hospitals. 40 hospitals in New York are triaging care. And the biggest stat I think that people need to realize is that they're projecting that there'll be 5 million people off of work due to illness. So in other words, let's say this is just like the cold, but if everybody in the nation gets a bad cold at the same time, it can shut down the nation. And that's where you get into the problems of a highly infectious pathogen. And remember, we discussed that it presents new and different problems than just something that isn't very infectious, but has a high case fatality rate. So I think this is problematic. I think the CDC is giving right now confusing messaging. I really don't agree with their back to work philosophy and strategy. I think you need to...
The 5-day thing?
Yeah, you need to do testing afterwards. England does. The data out of the UK shows that at day 6, 10 to 13% of people may still be infectious. So that I think is either too soon or let's start doing some rapid testing. And rapid tests do work. We had an outbreak in a close family unit with us with COVID, and I tell you, Jack, it was kind of scary, but all mild symptoms, luckily. It involved 2 of their children that were under 5 that went to daycare, weren't vaccinated. They were highly positive, but only mild symptoms. And the rapid tests, those were positive within 2 seconds. I mean, it was like putting a large marker across that
Right.
COVID line. And the wife, she was faintly positive, again, very mild symptoms. The dad was negative. He did not get the virus. He did not believe the rapid test, went out and got a PCR test, and it was still negative. Both of those members were fully vaccinated plus boosted. We had another family member that wasn't vaccinated or boosted, and this is a different family unit. And their son, who was 11, went into the ROTC at school. The story was brought back COVID to the family. The dad developed, I would say, a severe infection with anosmia, still has trouble smelling. Wife is still in the hospital after being on the ventilator, and it's now going on 2 months, and she's severely ill. Neither of them were vaccinated. So the message is get vaccinated, and all the people who are worried about COVID, remember, Delta's still out there.
Thank you, Dr. Kevin Kavanagh. We'll talk to you on Friday.
Thank you.